Good afternoon, folks. Gracia Pierre-Pierre here, sports medicine specialist, aka Black Stallion. Today, we're going to talk about concussion, awareness, and education. This talk is brought to you by Imbert Productions for all your editing needs, and by Physician Thrive, a group of knowledgeable advisors that specialize in helping physicians manage their finances without anxiety. The reason I put that video together is because over the past couple of weeks, I've gotten a lot of questions about concussions. What is it? How do you get it? What are the symptoms? How do you manage it? What's the recovery time? And what's the prevention? What's the definition of a concussion? A concussion is a form of head injury caused by a direct or indirect hit to the head or the body that results in the brain shifting within the skull. It is a transient neurologic event followed by a course of complete recovery over a relatively short period of time without any complications in the overwhelming majority of athletes. It is a clinical diagnosis. It is all about how you feel and act. There are no blood tests, no MRIs, no x-rays, no CT scans that can make the diagnosis of a concussion for you. There's a myth out there that you have to lose consciousness in order to suffer a concussion. This is not true. What are the signs of a concussion? I must say that signs are whatever the provider can see on a patient. Just to name a few, patient could look confused, patient can have a blank stare, patient can have sensitivity to light where he protects his eyes from the light. Patient can lose consciousness. Again, these are some of the few signs that a patient can experience when they're concussed. What are some common symptoms? Symptoms are whatever the patient reports to the physician. So, patient can say that I feel dizzy, I feel sick to my stomach, I feel like I'm in a fog, I feel tired. There are up to 60 identified concussion symptoms. An athlete with a concussion could have anywhere between 1 to 23 different symptoms. What's interesting about a concussion, you may get injured today, but don't develop any signs of concussion before 48 to 72 hours, making it a bit difficult for the provider to make the diagnosis. Let's make it that I'm a provider in my office and there's a patient that comes to see me reporting symptoms such as headache, neck pain, feeling sick to stomach, difficulty to sleep, feeling irritable, feeling low in energy. These symptoms are pretty vague because they could be concussion symptoms, but they could very well be symptoms of depression or symptoms of low thyroid. Until you ask the question of, has there been any injury where the patient can say, yes, a couple of days ago, I slipped and fell and hit my head to the ground, you're not going to be able to make the diagnosis of a concussion. How do you initially manage a concussion? Again, let's take the example that I am a provider on the sideline of a football game. Two players get involved in a helmet-to-helmet collision. They stop the play. I go up the field. I evaluate the patient, make sure that it's not in a coma. I make sure that there's no open head injury, because if there's coma and open head injury, this patient is going to the ER. Now, patient is alert and oriented. It's a closed head injury. Patient is able to get up his feet and come off the field. So I help the patient off the field. And once I'm on the sideline, I run him through a series of questions and quick physical exam to have an idea of whether or not the patient is concussed. Then 15 minutes later, I run the patient through the questionnaire again. If at first patient had a mild headache, now it's a terrible headache, as in the worst headache of my life, or patient was just sick to his stomach, now vomiting profusely, or patient was alert and then 15 minutes later the patient is drowsy or even lose consciousness. All these are cases where I would refer patient to the ER. Now, let's make believe that the patient 15 minutes later is still stable, symptoms are about the same or mildly improved. I tell the patient to go home with the following recommendations. He needs to rest, both physically but also cognitively, meaning no practices, no exercising, no games, no horseplay around the house. If the patient is a student athlete and got hurt, for instance, on a Wednesday, you don't go to school on Thursday because that would put stress on the brain. You tell the patient to keep any electronics such as laptop, iPad, video game, television, cell phone to just 15 to 20 minutes a day. You tell the patient to sleep 8 to 10 hours at night. You tell them to eat 3 big meals because the brain is going to need energy to recover. You tell them to drink a lot of water to stay hydrated. If they have headache, to stay away from naproxen, Aleve, Motrin, ibuprofen, Advil, because this medication may worsen any small bleed that was ongoing in the brain. In that case, they need to use acetaminophen. And then you tell them that, for instance, if they are pretty young, 10 to 11 years old, you tell them to wait at least 48 hours without any symptoms before they can initiate a return to play protocol. And if they're older, 14, 15, 16 and up, you tell them to wait at least 24 hours before they can initiate a return to play protocol. There is no drug or any other therapy that can accelerate or recovery from concussion. It's all about rest. You do not want to tough it out. You want to make sure that you ignore your general athletic voice telling you to ignore your symptoms. What is a return to play protocol? The return to play protocol is a series of stages that we run the patient through to make sure that he recovered from his concussion. So it has 6 stages. The first stage is stage 0, where you rest. The second stage is day 1, where we run him through a light aerobic exercise session. Day 2, moderate exercise session. Day 3, sport-specific exercise session. Day 4, practice without contact. And if there has never been one day where he developed any symptoms, he can go back to foot practice or even game after being cleared by the provider. A few numbers. 85% of concussions resolve in 7 to 10 days, especially if the older you are. But the younger ones can take up to 2-3 weeks before they recover from their concussions. Of those who do not fully recover within 1 month, 50% will have some form of mental health issues such as anxiety, depression. On rare occasions, returning to play while still having symptoms has resulted in death. This is what we refer to second impact syndrome, where a brain that was not fully healed gets hit again, swells up within the skull, and causes death. Return to school is very important because you cannot return to play before being able to return to learn. And what does that entail? The people in charge in school should be able to implement a return to learn protocol where they allow patients to attend half sessions, half days, give them 1 test a day, give them more time to complete the test, allow them to go to the nurse if they feel sick, if their symptoms are aggravated by being in class. and really support them while they're recovering from their concussion. How to prevent a concussion? You need to follow the rules and regulations of the sport that you participate in. You need to respect the well-being of your competitors. Do not take advantage of moments of vulnerability of your opponents. Activities with no risk is unrealistic. Sports and risk are mutual partners. They go hand in hand. The key is safe participation. Thank you for listening, for taking the time to listen to my presentation. This was a presentation about concussion awareness and education. So we went over the definition, we went over accompanying signs and symptoms of concussion, how to recognize it, how to initially manage it. We talk about the recovery time, we talk about some statistics, we discuss the return to learn and return to play protocol, and we talk about prevention. If you have any questions, please address them to my Facebook page at Black Stallion MD. This is Gracia Pierre-Pierre, sports medicine specialist, aka Black Stallion. This is how you mind your own business.